Infection control. Objectives: describe the basic concept of infection control and why it is important. Apply standard and transmission-based precautions to prevent transmission of various infectious illnesses and diseases like tuberculosis and MRSA. Describe various infectious illnesses and diseases and how they are transmitted from one person to another. Transmission of infection. Reservoir, portal of exit, method of transmission, and susceptible host. Chain of infection, a sequence of events, sequences of elements that allow infections to be transmitted or occur. Breaking any of the links in this chain will help stop the spread of infection. Break the chain and you can help save lives. Infectious agent, microorganisms capable of causing illness or disease, bacteria, viruses, fungi, and parasites. Reservoir, the place where the organism lives, grows, and multiplies. That's humans, animals, and the environment. Portal of exit, this is the way that the infectious agent leaves its reservoir. Method of transmission, the route by which the organism is transmitted to the host, which varies by organisms. Contact, droplet, airborne, bloodborne. Some agents are transmitted by more than one route. Standard and transmission-based are the two tiers of precautions to prevent the transmission of infectious agent. Susceptible host, a person who lacks the ability to resist the invasion of an infectious agent. Susceptibility increases and compromises the person's ability to protect themselves. Compromised immunity, presence of medical devices that bypass the body's natural defense barriers, age, usually the elderly at higher risk, and non-intact skin or mucous membranes. Contact transmission. Contact is the most common way infection is transmitted from one person to the other. It can be direct or indirect. Used for antibiotic resistance organisms that are easily spread by direct contact from person to person or from environmental services. You got MRSA, VRE, herpes, or C. diff. Direct transmission. Infection is transmitted from one person to another through direct physical contact. MRSA, VRE, mononucleosis. Droplet transmission, influenza, parainfluenza virus, RSV, and pertussis. Blood or body fluids from an individual enter the caregiver's body through a cut or abrasion in the skin, sneezing, coughing, or talking. Mites from scabies infected patients are transferred to the skin of a caregiver while they are having direct ungloved contact with the patient's skin. A healthcare worker develops a sore on his mouth and after contact with a patient with herpes simplex virus, HSV. Indirect transmission involves the transfer of an infection through a contaminated object or person. Many microorganisms can live on surfaces for extended periods of time. Hands not properly washed. Proper hand washing is essential. Use soap and water hand washing instead of alcohol-based product when visible soil is present. A provider touches an infected body of one individual and then touches another individual. A child sneezes on a stuffed animal he's playing with and then another child plays with that toy. Airborne transmission occurs by the distribution of either airborne droplets or small particles which can be inhaled by another person. These airborne germs are tinier and lighter than droplets, allowing them to travel through ventilation systems and can live a long time in the air, more than 3 feet through the air. TB is spread through airborne transmission. They can also travel through air currents and can be inhaled. Blood-borne pathogens. Disease-producing microorganisms spread with blood or other body fluids contaminated with blood from an infected person. Infectious agent can live in the bloodstream and in other bodily fluids that contain blood components, seminal fluid. Mucous membranes found in the mouth, vagina, or rectum may also allow germs to spread through contact with blood or secretions containing blood. Infection prevention, hand hygiene. Single most important practice to reduce the transmission of infection. Essential element of standard precaution. Alcohol-based hand products are appropriate for use unless your hands are visibly soiled. If hands are visibly soiled, wash them with soap and water. Standard precaution based on the principle that all blood, body fluids, secretions, excretions, non-intact skin, and mucous membranes may contain transmissible infectious agents. Personal protective equipment, PPE, you have gloves, gowns, and masks. Multiple drug resistance organisms, MDRO. MRSA, VRE, and gram-negative bacilli, GNB, are infectious bacteria that have developed resistance to medications typically used to treat infection. The option for treating individuals with these infections are often extremely limited and have side effects. The transmission precaution used for MDROs is contact precaution is often sufficient.